today I'm giving you 7 toxic ways your feet can show signs of kidney failure. Over 35 million Americans have kidney failure, yet most don't even know it. They have no idea. 1 in 3 is at risk. One of the main reasons that patients show up to my kidney clinic having no idea that they have kidney disease is because kidney failure symptoms are often silent and sneaky. Many patients think that just because they make good urine that they couldn't possibly have kidney failure. They'll tell me, Dr. Frida, I know I don't have kidney disease because I make a lot of urine. But that couldn't be farther from the truth. I have actually had to place many patients on dialysis who make great amounts of urine, but the kidneys still don't work. And that's because a decreased urine output is just one of the many possible signs of kidney failure. Other signs of kidney failure can be found in the feet. So let's go ahead, let's jump in, and let's talk about the 7 toxic ways that your feet can show signs of kidney failure. Number 1, foot swelling or edema. Yes, if you have swollen feet, this could be a warning symptom of kidney disease. So yes, your kidneys are responsible for helping you to filter out excess water. They also help with your sodium or your salt balance. If you are retaining salt and retaining fluid, this can lead to swollen feet, which of course can be a warning symptom of kidney failure. How do you know if you have swollen feet? Well, you look at them. You use your eyes and you look at them. You know if your feet look big or if they look swollen. And if they do, yes, it could be a warning that you have something going on with your kidneys. Also, if your socks are feeling tight, if you can't get into your shoes, if you take off your socks and you have these indentations, you can even check to see if you have pitting edema. So if you take your fingers and you press into the skin of your feet, hold it for a few seconds, and then you lift your fingers and you still have the indentation of your fingers. If you have pits, that's pitting edema. You want to consult your doctor immediately because this could be a way of your feet letting you know that you have kidney disease. Oh, you might be thinking that when you wake up in the morning, your feet aren't swollen, so you might think you're okay. But if your feet are swelling at the end of the day, especially if you've had prolonged standing, prolonged sitting, prolonged activity that's had you on your feet, it could still be a problem. So yes, talk to your doctor and have it checked out. Number 2, numbness or tingling of the feet or peripheral neuropathy. So if you have kidney disease and you get a buildup of toxins, specifically uremia, well, this can affect your nerves and cause you to have a neuropathy. And yes, this neuropathy can affect your feet. How will you know? Well, you can get numbness and tingling in your feet. You can even get a burning sensation or a decreased sensation or no sensation at all. So if you're walking around barefoot and you have numbness and tingling, that means that you might step on a splinter or something of that nature and actually put yourself at risk for an infection. But because your feet are numb, you could have no idea. So this is serious. So if you indeed are experiencing numbness or tingling in your feet, please pay attention because this could be a warning symptom of kidney disease. Number 3, foot pain or discomfort. Now, this is an important one because you can think of all kinds of things that cause foot pain, right? If you're wearing uncomfortable shoes, if you've been walking or jogging, if you're wearing some cute little pointy-toed shoes that you know are a half size too small, but you wore them anyway, that can make your feet hurt if you stub your toe. You can think of a million things that can cause foot pain, right? We'll make it 1,000,001 because kidney disease can also cause foot pain. And this is how. Your kidneys are largely responsible for your bone health. Did you know that? No, it's not really common knowledge. Well, your kidneys are responsible for how your body metabolizes calcium in a lot of ways, phosphorus, parathyroid hormone. And if these substances are out of whack, it can lead to renal osteodystrophy or kidney-related bone disease, which, yes, could cause bone pain. So if you're having bone pain in your feet, this could be one of those toxic ways that your feet are showing you that you have kidney disease. Now, here's another interesting way that foot pain can be related to kidney disease, and that is through gout. Yes, the dirty G word, gout. What does gout have to do with kidneys? Everything, I'm telling you. Your kidneys are responsible for filtering out the excess uric acid in your blood. So if your kidneys are not working properly, if you have kidney disease, well, then you can get a buildup of uric acid. If you get a buildup of uric acid, then that uric acid can crystallize in your joints. And guess what? It can crystallize in that big toe, that first toe, and cause you to have a gout flare. So yes, even if you have foot pain due to gout, it could still be a warning sign of kidney disease. So make sure you consult your doctor and don't let this sneaky sign get past you. Number 4, changes in skin color on feet. Yeah, changes in skin color. I have so many patients who come to my kidney clinic, and while I'm waiting for their lab work and I'm doing the history, I can look at their feet and I already have a pretty good idea that they are likely to have kidney failure. And this is how. Well, circulation. Kidney failure can affect your circulation. And if it affects your circulation, then it can also lead to a discoloration in your feet. This is how. So the same disease processes that will affect the vessels in your kidneys and cause kidney failure, like diabetes, number 1, high blood pressure, number 2. Well, these same processes can affect the vessels in your feet and give you a circulation problem, like a peripheral arterial disease, or it can give you a poor venous circulation. It affects the way that the blood circulates in your veins. So, for example, If you have kidney disease and it's associated with a poor circulation in the arteries, a poor blood flow to your feet, then that's going to give you decreased oxygen, decreased perfusion, and it can lead to you having a pale or a light color in your feet. And it can even lead to your toes looking blue, right? If you don't have enough arterial supply, enough oxygen flow, then you can get blue toes. Well, if the circulation is cut off for long enough, it can lead to a gangrene in your feet, and you can actually get black toes or black skin. Okay. So right there, from having poor circulation, poor arterial circulation, you can get whiteness in the feet, blueness in the feet, or even gangrene and black toes. That's one way that your feet can show you that you could have kidney disease. It can be related. You can also have issues with your venous circulation, okay? And your veins are responsible for helping your blood return to your heart, okay? Well, if you have kidney disease, then it can be associated with a poor venous flow, and this can lead to a congestion or backup of fluid in your feet, and it can actually cause the feet to be very ruddy or red, okay? You can have a hyperpigmentation or dark areas of the skin. Other things that can affect the way the skin looks in your feet are electrolyte abnormalities, okay? If you, for example, have high phosphorus in the blood and it's making you itch and you're scratching, that can lead to some hyperpigmentation or some dark coloration in the feet. Also, remembering that the number one cause of kidney failure is diabetes, well, some of the disease processes that affect diabetes can affect your feet. For example, if you have poor wound healing from diabetes and you have kidney disease, well, then you can actually get wounds, you can get gangrene, you can get ulcers, all of these things that can affect the color of your feet. So yes, changes in skin color can be a warning sign that you have kidney disease.